couple hits a wall, when they feel like they're having a lot of issues, maybe there's been a huge lie or a crisis in a marriage or a relationship, should they jump straight into couples counseling?
No.
The most important thing you need to know about couples counseling is that there is a right time to do it. So that might sound funny because you're thinking, well, I have a problem, we need to just go take care of it. But there needs to be some criteria that's met in order for it to be safe.
Couples counseling is huge, and it's okay to feel hesitation because there are many cases when couples counseling is not actually the right step for you. We're going to show you the 5 signs you need to see in your relationship to know if couples counseling is the right step for you. But if you don't hear anything else, you need to hear this. You are brilliant. The decision to get help is a really good decision. We don't know what you're going through, but with help, things are going to get better. So we made this to help you figure out what the right step is. But what might be just as important as knowing if couples counseling is right for you right now is finding out if your coach or counselor is the right fit for you.
If you're going into a situation where maybe that counselor or even coach doesn't have the training in what you're needing, and you walk in there, you can actually aggravate the issue more than before you walked in there. And that's not what you're looking for. You're looking for help.
And to help you learn what to look for in a coach or a counselor, we sat down with someone who we think is one of the greatest sex therapists in the world.
How valid of a concern is it that people will go to therapy and get screwed up, or coaching?
Yeah. So you're asking a very big question.
In addition to talking through the 5 signs you need to see in your relationship, the Dr. Jenna Mountain is going to break down what attributes we need to look for in a coach or a counselor. What you're facing might feel like the end, but getting help is probably more normal than you realize. The truth is that even couples who have really nice espresso machines in their house and vacation in 30A have serious issues too. We know this journey can be really hard unless you have help. These are the crafts, James and Teri. They don't know how the internet works, anything about YouTube, TikTok, or social media. And that's okay, because they know a bit about something else: marriage. In fact, they've helped some of the most influential couples in the world, and they've also helped couples going through the hardest situations imaginable. The reason why James and Teri are able to help couples go through really hard things is because they've been through it themselves, and they came through the other side. The greatest marriage podcast ever, Marriage Health with James and Teri Kraft.
Should they jump straight into couples counseling?
No.
Why not?
They need to do individual work first. People ask, should they just jump right into couples counseling? Yes, if they have individual counseling as well. Because obviously there's 2 brokens don't make a whole. And so we have to look at the brokenness on an individual basis as well. You might be saying to me, James, my partner is the screw up, not me. He or she went and did the crazy, and I didn't do that. So why do I have to go to counseling? Because you need support. You're gonna find yourself in a place where if your partner betrayed you or has been lying or just destructive behavior, that's called trauma, the traumatic experience. What you're gonna need is support. There's gonna be a lot of confusing thought processes. Why me? Was I not good enough? And this and that. And so you have to be able to work through those things. If not, you carry it on your own. So this is advocacy for you today, because you know what? You're worth it. You're worth it. And I would love for you to be able to look in the mirror and say, you know what? I deserve to have this attention brought on me in a positive way so I can have care and support and a partnership so I can move forward in healing and health in my life. And then what I do with my partner, if he or she continues to do the same exact thing, then we can meet there as one.
The reason why individual counseling for both you and your partner is so important is because it allows you to show up to couples counseling with your voice. Your voice is powerful, and it might be something you've lost in your relationship. A common indicator that you've lost your voice is this: I'm terrified of couples counseling because I'm afraid my spouse and my counselor or coach will both join together and single me out as the problem, and there's nothing I can do about it.
Can I ask, how do I prevent the therapist and my spouse ganging up on me? I feel like I always look like the crazy one in the room.
Yeah. I think it's really important when you enter the room within a couples counseling or coaching process. I think that we're always going to be potentially defended, meaning like I'm going to go in and I've got sort of my protection up because I don't want maybe the gaslighting I'm experiencing with my partner, or maybe I've experienced that growing up and I'm like, that's the last thing I want, is for some perceived authority figure to do something negative to me. I think that most of the time when you're dealing with good and healthy, knowledgeable professionals, they're going to ask hard questions, they're going to dig. But I think the important thing that I want everyone to hear that's listening is that you have power. If something feels uncomfortable, if it's moving in a direction that feels unsafe, for you to go, hey, I want to just back that up for a minute and maybe I need some clarification there. Can you clarify kind of what direction you're going? Or to say, hey, I might need a minute. I need to understand a little bit more of what's happening. I have had some gaslighting. I've had, some experiences where I was really confused by some of this emotional trauma. And that's kind of feeling like that's happening right now. And I need to put a pause here. The fear is that somehow I'm going to look like the deranged one, or I'm not regulated and I'm crazy now and I have to be perfect or I'm going to be manipulated. And I really want to help people to understand what that fear does because of the gaslighting or because of maybe the trauma that I've suffered. It moves us into a place where we aren't completely honest and we're not completely compassionate with our own story and with what's going on. We're not necessarily listening to what needs to happen here. So we can tend to kind of shrink back. And then we're sort of letting things happen in the environment, that couple's environment, where we're thinking this is feeling really uncomfortable. This isn't safe, but I'm not saying anything. So that immediately is going to put me back into that seat where I'm going to feel unsafe.
So you're saying that you can still have boundaries even in a therapy setting?
Absolutely. I mean, you should, right? There's so many women that I work with, and I would say, men too. I think in general, but they will come away from couples counseling and say, yeah, that just felt super re-traumatizing, because I was experiencing a lot of unsafe language, or I was, the stories were flipped, or they were not correct. There was, gaslighting happening within the session. Maybe the professional isn't aware of certain things, and so their line of questioning's feeling really uncomfortable. And so I went away feeling super traumatized. Oftentimes, one of the processes that we'll work through individually is where was your voice? And it's like a lot of women are sitting there going, I didn't think I could use it there. Absolutely. If you're in a couples coaching or counseling session, that's when you're supposed to, right? Be able to express what's going on. And then we usually, the second to layer into that is usually, I'm afraid to use my voice. I'm afraid. Because if I do, then I'm going to get retribution, or there's going to be more gaslighting, or, the list goes on. We're talking about trauma. We're talking about, a really potentially abusive situation. So at that point, we got to say, wait, let's back up from this and make sure that there's certain criteria that's being met before you even get to that point. And I will go through a specific list with my client individually or as a couple and make sure that these criteria are met in order for the couple's process to be as safe as possible. And sometimes my client will go, oh my gosh, there's 2 of these criteria that are completely not being met right now. That environment invariably is going to have some unsafe elements, even if the professional is really great and they're doing the best that they can. But if those criteria aren't being met, you're going to feel unsafe. This is where I maybe use my voice and say, okay, maybe this needs to pause until there is some safety here, or there's some of these criteria met.
And so These are the 5 signs you need to see in your relationship to know if couples counseling is a safe place to process and find healing.
Okay, so here are 5 signs that you are ready. The first sign that I want to look for is, now I'm going to use the word sobriety is established. This basically is saying that any repetitive behavior pattern is something that has been happening over and over and over, that has been hurtful, damaging, destructive, that there is a sobriety around that, meaning that that is no longer active, right? And that's no longer been active for, let's say, 60 to 90 days, right? So there's like this cooling off period, right? From this repetitive pattern. Those repetitive behavior patterns could be things like obvious addictions, whether that's substance or that's pornography, that's sexual addiction. We need to have established sobriety there. That could also be things like hurtful patterns of raging, lying, gaslighting. It could even be repetitive behavior patterns around workaholism, all those kinds of things. If those things are, there's a healthy control. Because if not, what's happening in the couple's environment is that you're taking all your time to deal with the repetitive behavior pattern. You're going to be paying for a lot of sessions, you're going to be putting a lot of effort in, when really one of the partners who's dealing with an addiction or a repetitive behavior pattern that's hurtful, they should be working on that on their own, right? They should establish sobriety first. Second thing is empathy is present. Now, when I say empathy, that is obviously empathy is being able to sit with or hold space for the feelings and experiences of another. So if I'm unable to have any empathy for my partner, or my partner is unable to have any empathy for me, meaning like I can sit with their feelings, I can hold that with them, and I can even feel that within my own heart and look at them and be able to say, okay, wow, I see you. If we're unable to do that to any degree, somebody doesn't have any ability to even hold space for their partner. That's not going to make for a good couples healing environment. The third thing is that truth has to be established. So if I'm sitting in a couples environment and I'm wondering if my partner is telling the truth because there's no truth, they haven't even told me what it is that I've asked them over and over and over about, and they're like, I'm not telling you the truth, or you're crazy, but you know that truth hasn't been established, and they're withholding the truth because you can't handle it, is how they would maybe phrase it. I'm just protecting you by not telling you the truth, or it's none of your business, or whatever. If that hasn't been established, if truth hasn't been established, the couples sessions are not going to work. They're not. There's no success there, right? The fourth is that mental illness, addictions, and trauma are being managed. Meaning, if any of those things exist, if there is an ongoing mental health issue, there's no shame here. We don't have to feel like there's failure. What we need to do is we need to own it and we need to get help for it, right? So if there's something like anxiety, depression, if there's bipolar that's happening, if there's personality disorder, if there's narcissism, if we're dealing with an addiction and we know that there's an addiction, yet I'm not, attending my group work, or I don't have a therapist that's working me, or a recovery coach that I'm digging in with on a weekly basis, and I'm just not even going to own that, then how can we kind of work forward with our relationship when those things aren't even being managed? If I've got a lot of trauma from my childhood that's not being managed, when I go into a couples environment, what's going to happen is it's going to bring up things. If that's what a couples environment does, it kind of takes two people and all their brokenness and all their wounded places, and we start to kind of look at it together. Well, you're going to feel an increase in symptoms sometimes. Let's say one of us or both of us have trauma from our past. If we don't have that managed, or is someone helping us with that, then this is going to feel really, really, really re-traumatizing. So that's really a really important step. And then the fifth really important one is that reconciliation is mutually desired. So if I'm in a couples environment and I want to see this thing move forward, then we both have to kind of want that. If you're actually looking for for there to be a built intimacy, or we're building connection, and we're trying to heal from our attachments, and we want this to feel better, we want it to look better, we want to be more together, then you both have to want that. That's one of the most important things we start with. This is, do you both want to be here? Those are the signs that are really going to show whether a couple's process is going to be successful. So if you're not seeing, one or more of these signs, then my encouragement to you is to both be open, both get curious about what it looks like to continue in an individual process. And if your partner says, no, I won't do it, then do it for yourself. That's where you start. Listen, a couple's coaching or counseling process can get really, really traumatizing really, really fast. If it's not the right timing and you don't see those signs, or your professional doesn't know about what you're dealing with.
No matter where you are on the spectrum, whether you're ready for couples counseling or coaching, or if you just need someone to come alongside and support you, we want you to know what's important to look for in a coach or counselor. Dr. Jenna Mountain runs a massive practice. She knows this world extremely well, and she's one of the most qualified people doing this work. And so, we asked her for her insight.
How valid of a concern is it that people will go to therapy and get screwed up, or coaching?
Yeah. So you're asking a very big question that would like, in order to answer it well, to come at it a couple different angles, if y'all are cool with it. All of these coaches and counselors are humans.
That's right.
We don't have to be perfect to be good at what we do. There are some terrible garbage ones out there. So both can be true, and I hold space for both. There are some basic things that go into being a good therapist, a good counselor, and a good coach that unfortunately not enough people in our field do. In fact, I just had a conversation today with someone who's wanting to get into the field, and they just wanted to sit down and have coffee and ask me where would you go? What would you study? How would you do it?
Yeah.
And more than the academics, although that is a really big piece, I think the best coaches and counselors are the ones that are doing their own work.
Yeah.
Mm-hmm.
And so I actually think, you need all of the training. I do think that is important. But how you apply the training, how you sit in front of someone, I think the biggest component is your own personal health.
That's right.
Yeah.
I know that I have my own therapist that I go and I spend time with on a bi-weekly basis. And so she drills in me, I'm working on me, and I'll probably do that till the day I die. But every time I go and I work on me, I'm able to go and work on help with others where they're at.
Oh, yeah.
Because one, it softens my edges. I'm able to give more to them in that process, and I know that my therapist, she's been honest that she still works on her.
Yeah,
And
I do. I still work on me. I'll return.
Yeah. And I know, Teri, you work on you. It's something that if we aren't doing that, how in the world can we meet people in their place of trauma and pain?
Yeah, I think, so one of my mentors said this is she says it all the time. She says, you can't teach what you don't know, and you can't lead where you won't go.
Yeah.
And so it doesn't mean that you haven't been able to do good work up until that point, but you will hit a rock at some point. And my personal and professional belief is that we just never arrive on this side of eternity. So there's going to be always something you work on, just the next layer, the next piece. And so we can't know it's happening unless we are going seeing our own therapists and coaches.
Exactly.
Right?
So that's where the destructive pattern, we can be reactionary, we can shut down, we can be non-empathic, to that person. That person feels like they're being stonewalled in that process, right?
What does it look like for somebody who's on a journey, who might be listening, who's on a journey, and they're like, I just don't want to get hurt by a therapeutic process?
Therapists, I would say by and large, all of them genuinely really care. Their ability to care well is going to depend on the work that they've done on themselves. Can they be differentiated, which is you and I are separate people, right? Therapists are still human. So again, the quality of their ability to hold that space with boundaries that create the safety needed for that deep work is all going to be dependent upon, I have gone and done my attachment work.
That's right.
Right.
Yeah. Because from jump, if we really knew how to work with pain, our clients would be learning how to not avoid it.
Okay, that's that's huge.
Yes. And I, if you came to my office, sat in my intake, we're going to talk about how this is going to hurt. From jump, I am talking about this is a painful process. That doesn't mean it's an unsafe process.
Yeah.
It
Yeah,
doesn't
that's
mean
right.
it's going wrong. I mean, I think and to some degree, I get it, right? Like if I go put my hand on the stove and it hurts, the pain tells me to pull back, right?
Yeah.
So
Right.
there is some like natural wiring in us to be pain avoidant
Yep.
as protection.
That's right.
But we are also higher level beings in creation, and there is a part of the pain that actually draws us into some growth.
Yeah.
Yeah.
And so not all pain is supposed to be avoided. And I am always going to say this when I talk about these things in this context.
Yeah.
And that idea sometimes feels like it's in conflict with the very important thing of the cycles of abuse.
Yeah.
Right? I'm not telling those people to go back into pain.
Yeah.
That's not the type of pain that I'm talking about. So
No.
I'm not, some people will take that and stay in cycles of abuse.
Yeah.
That's not what I'm talking about. You have a whole other set of people that like every time something hurts, it means something must be wrong. That's not always the case, or that it should be, maybe something's wrong, but it doesn't mean you should pull out of this process. It means that this has touched on something and we can engage it to fix it. We can engage it to heal it.
Yeah.
Yeah.
So working with pain is a nuanced and complex dynamic that because we've avoided our own work as helpers,
right.
we don't tend to do
Well,
well.
when someone's
Yeah,
dealing
that's
with
good.
their own pain on an ongoing basis, it creates a not a familiarness to it, but kind of a tolerance of I can handle pain.
Yes.
I'm resilient. There's resiliency.
They
in
like
me.
their pain. The reason that good counseling and coaching works when you're with a healthy helper is that the human experience doesn't have some hard formula that you could just easily apply to navigating your pain, but a safe, trained, and educated coach or counselor is going to help you readjust your relationship with your pain.
Wow, that's good.
That is
Okay,
good.
so whether you're overplaying and doing too much pain and you're not getting out of
Yes.
unsafe situations, or you're pain avoidant to the point where you're like not doing your growth or not doing
Yeah.
your healing work. And so I think, and that's why it's so complex. I mean, if you've ever looked at like master's degree requirements for like counseling compared to all the others,
Yeah.
they are 2 or 3 times as long.
Oh, yeah.
It takes so much time just to get the like basic breadth foundation.
Yeah.
There's so much that happens post degree,
Yeah.
post licensure in your training. So I think the point is there's no hard formula. It is that we want to help you navigate the human experience healthier, the relationship with yourself, the relationship with your ability to listen to your nervous system and emotional and physical pain in a way that is proportionate and directionally appropriate.
Yeah.
Right. So some of the questions I would ask when people are wondering if their responses are healthy or not is I'm like, okay, like when that happens in that relationship, do you feel like your response is proportionate? Like it's that it is healthy for you to have a response, like an emotional response or
Yeah.
reaction to that, but maybe it feels too big.
Yeah.
And we're going to talk about, okay, tell me how you got to too big. What's
Yeah.
the measuring stick?
Yeah.
This all backs up to what we did not get as little kids, to trust our guts, listen, and have safe relationships. So it feels like a very like floating in space type magnitude. I did not get what I needed and I have no idea.
Yeah.
So it just takes time to acquire. It's like a skill set and a practice
Yeah.
Right.
that you have to develop in yourself. And you have, in my opinion, you have to sit at least in front of one human to go back and forth and volley the experience and have them give you feedback and have them reflect back. Okay, here's what I
Yes.
hear you saying, like to be the mirror.
For sure. So what does a listener do
Yeah.
to figure out if they're in I mean, we can't give it completely, but
Good, healthy, or bad
Yeah, like
situation.
how do we
Yeah.
help someone know like what is a good and healthy environment as opposed to maybe a counseling environment where it might be borderlining like
And there are
Not good.
bad unhealthy. There's like bad therapy, and then there's like unethical therapy, and like that's not the same thing. But I don't want anybody in either of them. I would say that like, so first of all, like I would look at the resume of training, because a lot of the specialization comes post degree, in my opinion. So like, I am an EMDR therapist, right? So I do eye movement desensitization and reprocessing. I did not get trained to do that in grad school. That was post grad school.
Right.
Not all EMDR therapists are trauma informed. Not all therapists are trauma informed, shockingly. Like that is actually like a practice and a specialty that not everybody gets. You can get it through courses. You can get it through experience and consultation and supervision. I had both. But I've spent years becoming a trauma therapist, you know?
There's also some that, I'm just going to be honest, like they don't know a specific, you know, I work with a lot of people that have dealt with betrayal trauma. So if they go into a counseling or a coaching environment and they have no clue about that and they don't know how to assess that, that can cause more damage.
Right. I mean, a lot of people come into counseling and coaching, if we start to funnel down to like, what's the core issue here? There were lots of variety of experiences and things like that. A lot of it comes down to a betrayal, an attachment wound. Like, how do I connect as a human to a human? Well, you're having a human to a human experience with that therapist, coach, or counselor. I have also, become a specialist in sex through training, through consultation, and through experience. Some people think that just because someone is an expert in relationships, they know how to deal with sex. That's not necessarily true. Nope, it's not true. I'm pretty territorial about that. Just because you're a specialist in marriage doesn't mean you actually understand everything that you would need to understand educationally and training-wise to sit there and mess with someone's sex life.
It's true.
But you will have a lot of people professionally and as a client consumer think that makes sense. And I get a lot of leftovers on that front.
It's good for someone to understand that the time and effort that someone takes to get the experience and the knowledge and the information is going to translate into a potentially safer place with specific things.
It's safe educationally, training, and information-wise. Now,
but the person has to do their work as well. We have coached couples with so many different situations, so many things that they're dealing with all over the world, and we understand that it takes a lot of time. I don't know. We know that it takes a systematic way of walking through this, and we want to be able to be an encouragement to you as well. So listen, if you feel like I want to know more about that, reach out. Life Unplugged exists to bring healthy coaching to individuals and couples regarding all of the things that I spoke about today. And I just want you to know that you're not alone in this and that there is hope. If you want to connect with us, the link is in the description.
Marriage Health with James and Teri Craft. If you feel like you need someone to come alongside you, a coach or a counselor, reach out to us. The link is in the description.